All right. My name is Carolyn Stout, and I am the manager over the education area, which is the early childhood development and care and the positive youth development focus areas. So section C has to do with client, how you describe your target population, basically. This entire section is worth 20 points. And the very first question has to do with how you identify and engage your clients. The goal for this is to differentiate the services that we have evolved or emerged more recently from those services that were provided from the start of the organization. So when looking at your target population, we did not ask you for demographics as part of your target population. We're asking you to describe it in this question in the narrative. So we really want to get to some very specific figures. We want this to be very quantitative in this section. Provide us with numbers, provide us with percentages. When you're talking about your demographics, gender, race, age, household makeup, etc. Tell us how many, tell us who. Don't just say, we serve a diverse population. Describe what it needs to be diverse, because that's a different definition for everybody. We want to know your geographic reach. Our counties that we encompass are Benton, Cedar, Iowa, Jones, Lynn, and Washington counties. So tell us who you're serving in those counties. You don't have to serve people in all of those counties. That might not be your same geographic reach. But tell us who you're serving in the different counties. Tell us about their income levels. As you see within the RFP, our primary target population falls 250% of the federal poverty level or less. So tell us how this population you serve relates to that target population. You may not collect federal poverty level information for your clients. You may collect it in a different way. So if that's the case, describe that to us. Describe what you use to determine household income and how you can identify that. Also, this is an opportunity for you to really discuss the trends that you're seeing for the population you serve. You can look back at what we put in our focus area framework for some guidance, but you also, as Judy had said earlier, you may have some specific trends that relate to your area. I'll speak to, just use RBAP as an example. They focus on sexual assault prevention with young kids. And so they have seen trends in cyberbullying and different things that have been happening throughout the internet. So they would probably incorporate some of that kind of work into this section. Also, one of the significant parts of this section is to talk about your client needs. What needs do your clients have? What are their barriers? Please articulate this very clearly, because this is going to connect with a later question that you'll be referencing that back. And talk about the number that you propose to serve with your strategy in this next fiscal year, not for 3 years total, but just take a year at a time, and talk about the number of individuals that you might have on a waiting list if that's applicable. So that kind of helps us set the context. So we have an example provided by the YMCA. This was just taken from their letter of intent, and it would not be a full example, but we really liked how they talked about how many they served and by age group, gave a percentage of those individuals that then would receive financial assistance out of the total population. when they're writing their proposal, they'd also want to tell us about the race as much as they could about that population, gender, geography, what qualifies for financial assistance, how does that relate to federal poverty level guidelines, what are trends that they're seeing, obesity, likely one, and as for those trends too, to be able to get as local and agency level specific as possible. That's not always possible. It's hard sometimes to get that level of detail with data, and we know that. But as much as you can bring it back as close to home as possible, that will be helpful. Okay. So section 2. Tell us about your organization's experience serving this target population. Talk about the length of time that the agency has been providing the types of services. So for example, Willis Beatty provided us with an example of the different categories of services that they provide. Again, this is just an outline so that it fits on the slide, but they've chunked out their work. Prevention outreach, been working on that for a little over a year. And what does prevention outreach mean? Shelter services has been a longer period of time. Access to support services or case management, about 5 years. For question C3, this has to do with outreach to the target population. So how do you find the clients to serve? Do they just walk in your door? Some of them likely do. But in some cases, too, you also have to get out to that population and connect with them. So we want to know what your intentional reach is to that population, and also what are your referral networks? Who refers clients to you? Who do you, well, we'll get to that actually later, but who refers clients to you? So, for example, Foundation 2 for their transitional living program provided us with a brief description of their work. So talking about what they are doing, providing outreach to youth ages 16 to 21 that are homeless and lacking safe, stable situations. And then that listing here some of the activities that they're doing. They're visiting areas that young people frequent to try to connect with them. Doing presentations to community providers, so letting folks like you in the room, other community providers know what they're doing so that those providers can provide referrals. That's community provides. Doing an orientation at Metro High School and other area high schools, and then referring to the program from other Foundation 2 programs and other community providers. So you see they have a variety of different activities that they're using. C4, question C4 has to do with what is your criteria for serving clients, and are there any eligibility guidelines that you use for serving clients? Again, some of you have more strict guidelines than others might in this category, but we would still like to know overall how you determine that a client is suitable for your services. So who is eligible to receive? Again, getting into some of that demographic information. And then describing any assessments that you might use, what processes you use to determine that a client is eligible. It may be some just solely based on income. It might be based on what their needs are. Doing an assessment to determine this client has X need and that matches with what our program's services are. Basically, also within this section, you want to define when a person begins and ends services with you. Do you have a cutoff where they're no longer eligible for services? You may or may not. have an example from Horizon's mental health counseling of this. So in this example, the needs are predominantly identified through self-report, also through collateral sources and diagnostic assessment tools. So they do some intake paperwork and then have a diagnostic interview to go over some of the more specifics. They have specific depression, anxiety, stress assessments. When working with children, counselors also obtain developmental and educational histories. Now, realizing not everybody's working in mental health, and your examples may not be so specific, but if you can think about them to know, like, what are those steps and procedures that you take to match clients to your services, that will help you answer this question. Do you have any questions about section C?
Can you repeat what you said about income guidelines? I think you said 250%, but
You'll notice that in the RFP information that we have identified up to 250% of the federal poverty level as kind of a general income guidelines. That is the point where families are considered to be fairly at a self-sufficient income level. So that's why we've chosen 250%. Yes?
We start programs serve people from counties that are not counties covered by United Way, East and Iowa. Do you want those listed in this, or because I'm assuming we're not asking for funding for those counties, or do you want us to exclude that and just focus on what?
I would just cover that information in your agency information to talk about the breadth that you provide, but not to talk about it in this in section C. Any other questions?